Evening everybody, I can see people are now starting to join, which is good, means the reminders are going out. Welcome to our Fertility Awareness Week events. This is event number 2. We are doing LGBTQ plus Path to Parenthood. So my name's Chloe, and I was part of your events team last night. So some of you asked some questions on our introduction to IVF event last night on things to do with surrogacy, donation, IUI. So you probably got an answer from me to direct you to this event this evening. So have your questions primed and ready for myself, Tom and Debra, who I'll be inviting to join in just a few minutes. So we'll cover everything as much as we can tonight and give you as much detail as you need to either start or grow your family with care. And just as you can see above my head, there is our first consultation offer code for £100, which gives you a saving of up to £150 off your first consultation with care. So we always advise you to get your first consultation done and initial tests, because then that gives our experts a really good idea of what is going to work for you, as we really want to personalise your treatment. So I think Tom and Debra are waiting in the wings, so I'll invite them on to join me. So I've got one. So I've got, hopefully they're coming on. Hello.
Hello, hi.
Hi, yeah, you're all right. And then I'll just check her on as well. There we go. So we're doing good. We're doing all right so far.
There you go, perfect. I'm on.
Wait for Deb, and then we'll go through the agenda and things like that. So hopefully she's doing all right. These things can take a few seconds, so I wouldn't panic too much. We have practiced this already in advance.
Sometimes
it takes a little time to get everybody in and on. Here we go. She knows that we're on, but if need be, we can make a start, and I'm sure she'll join us very shortly. So, Tom, if you're ready, do you want to do a bit of an intro?
Yes, so I'm Tom. I'm the medical director of Care Fertility in Manchester. I think I've been invited to speak on this particular topic because I see a lot of LGBT patients. It's a particular interest of mine. And I'm kind of responsible for the surrogacy in Manchester. So that's part of what we're talking about today. So I can go through some of your questions around surrogacy as well.
Yes, perfect. So we have got a little bit of an agenda. So we're going to start with single paths first, and anyone who's maybe looking to transition. And then we're going to go through same-sex female pathways, same-sex males, and then any extra ones that we feel like we need to, so we can touch upon like surrogacy and things like that as well. So it'll probably be about half an hour. But if we do go over, but we will try and get through all your questions. I'll manage them, and throughout I'll ask people to maybe dip in comments. If you want any extra brochures and information about your clinics, then I'll probably just get you to comment yes, and then later on throughout the thread I can arrange for our inquiry team to send those to you.
I think Debra's just tried to join, Chloe, as well, if you wanted to.
There we go.
Add her in, yeah.
Yeah, she's coming. So there we go.
There we go.
Hello.
You survived.
Yeah.
Hi guys.
I was going to say it's a bit slow. These things take a few minutes to get people to join, so I normally just Twitter on for a little bit and wait for everyone to come in. So Debra, do you want to give yourself a bit of an introduction?
Hi guys. So my name's Debra Bloor and I'm Care's Director of Governance, which is a fancy way of saying that I'm in charge of making sure that all our clinics follow all the regulatory rules that are imposed by our regulator, the HFEA. But when I do that, that makes sure that all of our patients get the safest and most effective treatment possible. And actually, I used to work with the regulator some time ago before I joined Care, and that means I know quite a bit about the law and screening and all the horrible consent forms that our patients have to fill in. So hopefully I can offer something, but this is my first Instagram live, so go with me, guys.
Welcome. We've had some new faces for Fertility Awareness Week, which you'll see later on in the week as well. So Tom and Debra are amazing colleagues of mine at Care and got very important jobs. So you're getting the expert advice direct from when you need it. So Debra is also a doctor as well.
A scientist. I'm not a medical doctor, I'm a scientist.
She's Dr. Debra Bloor as well. But when you come for fertility treatment, everyone has some sort of consent to sign from the HFEA. So Debra makes that a little bit easier and communicates any changes to our clinics to just make sure that you've got everything that you need, and it's explained in the right way so you feel fully supported. So with that, then we will kick off. I think our first thing on our agenda is if someone is to come and preserve their fertility with us, what would kind of be their first steps, I guess?
Yeah, I guess there's a variety of reasons that people want to preserve their fertility. Largely, it's people wanting to store eggs, but it can sometimes be sperm as well, either for preference, and there is kind of news really around male fertility declining. We've had an increase in men wanting to, or kind of people wanting to freeze their sperm. Now, as part of this, I suppose we're focusing on LGBTQ plus, and therefore a related reason is prior to gender reassignment, and whether that's prior to hormonal treatment or plus or minus surgery. So sometimes we would advise, or often we would advise, to freeze eggs and sperm before you start that process, and that's because the hormonal treatment themselves will temporarily, usually, depending on what you're doing, but it will put a stop onto your fertility, and it will mean getting or achieving a pregnancy with your partner in the future would be slightly more complicated. So we can support you with that at Care, and really, you know, we will just see the fact that you're wanting to freeze your gametes, and that's what we will support you with. And Debra and I have worked quite heavily on this area in particular, because we have now created a nice summary guidance that, you know, your doctors and your nurses would share with you when you came to us wanting to do this, about the screening that is required. And we've touched on this, that this is quite an important part of the fertility process, because the screening that you do prior to freezing your gametes determines really how you can use those gametes in the future.
Yeah.
And whether that is in a surrogate or a partner or so on. And there's lots of different situations that can arise throughout life. And that's what the guidance that you'd get from us is. So it's really, you know, you'd have a consultation with a doctor. We'd go through all of that and the implications for your particular situation. You might not know who you want to have children with in the future, and that's probably not uncommon. So, you know, in general, we would advise you to be as broad as possible into possibilities, you know, in terms of the future use, and therefore be less restrictive. There are ways, however, you know, if you're someone who has stored their gametes before and you've not necessarily thought about this, there are ways around it in some situations, but we will advise you on that as well.
Real. Yes. And I believe there was a law change, I think not too recently, but some people still aren't aware of it, that storage terms have increased, haven't they? So what are they now, Debra?
So the law allows everyone to store their eggs or sperm for up to 55 years, which is a long time, but obviously you could be very young, undergoing a transition, for example, or simply storing because, for some other reason, you might be having treatment like cancer treatment that might impair your fertility. So if you store when you're very young, that law now allows you to carry on storing for up to 55 years. So the only caveat is you have to renew your consent every 10 years. And that's a really good reason why we really encourage our patients to stay in touch with us and not to lose contact when they've stored their eggs or sperm with us.
Yeah, perfect.
Just to note, as part of the process, Care, you know, we will support you in freezing your gametes, but what really you also need as part of that process is kind of being part of a gender clinic and counselling and all of the support that you get as part of that process. So that's not something that Care do provide, but we can direct you into the local services for that.
Yeah, for sure. We want to make sure that every patient, no matter what they're coming for, is completely supported. And even if we can deal directly with something, we've got those partnerships and relationships in place to get you to the right place. You know, because there's nothing worse than feeling a little bit lost with it all, because sometimes it can be quite overwhelming. Like you say, some people thought too far into the future, they just know that's what they want to do and that's what they need to do. we can
And
also,
we will tailor your treatment towards you as
yeah,
well. Often certain patients will struggle with, in this particular situation, for example, will struggle with internal scans, and there's ways that we can get around that. We can talk to you about the type of sedation that we can give you, and so on. So yeah, we would give personalised care depending on your particular treatment.
yeah,
But I think Tom, the other thing I would say is anyone coming into one of our clinics should be absolutely comfortable and confident that we're going to do the best for you. And if you're at the very beginning of your journey and you haven't, and I know there's very long waiting lists at the moment for referrals to gender identity clinics, even if patients are quite at the beginning of that journey, we won't prevent you storing your eggs or sperm with us. Come talk to us would be my encouragement.
yeah,
We're here for you, and if
Yeah.
you'd like to just explore those options, come talk to us.
yeah, no, absolutely. Because there's going to be people joining who might be in the middle of the process, or might be at the point where they're about to have treatment, or they might be thinking about it. So we're going to have a range of people, but we just want you to feel like you've got a group of dedicated and passionate people, I want to say, who really want to help with this. And yeah, they've got sort of, I always say, a personal interest, because it's our jobs at the end of the day, you know.
Mhm.
Yeah, we all have some sort of investment in it, and we want you to feel like we're part of. You could speak to us like you would your friend or your family. That's literally how comfortable we want everybody to be. So,
Absolutely.
yeah, definitely. So, have we covered most of the fertility preservation? Do we think? Is there anything else we need to?
I think so. I imagine that most people here wanted to know
Yeah.
about kind of fertility treatments rather than fertility preservation.
So, yeah, thanks for your patience, everyone. If this is what you got come get onto, then we'll touch upon that now. So, a lot of people asked last night on our event, particularly about IUI and IVF for same-sex female couples. We'll cover all the other pathways, but that was the one that I got asked most last night. So I was like, come to the event on Instagram on Tuesday with Tom and Debra. So we'll start off with that, I think. So same-sex female pathways. If you had a same-sex female couple coming in for a consult, how would that kind of look? What would they start with?
Yeah, so it really depends on what you're wanting to do and what stage you're at, I suppose. So some couples will come to us and they will both have investigations because they're not quite sure what they want to do, and therefore they'll both have a scan and blood tests and see a doctor and then go from there.
Yeah.
Some couples, on the other hand, will know for sure that one partner wants to carry the pregnancy. Or they might want to donate their eggs to another partner, to the other partner. Or a lot of same-sex female couples will start with IUI and come with that as the idea that they're wanting to start with. What we will do is we won't necessarily dictate what you should do. We will really just give you the percentage chances of success and what the whole treatment looks like for each option. And then you would be then guided by that and kind of a conversation on your particular situation, what you would like to do. So it is variable. Like I said, the vast majority of same-sex female couples start with IUI, and that's because it's probably the most cost-effective to start off with, and therefore it's less medications, it's less medicalized. The whole process can be a little bit more natural. So that's the mainstay treatment initially, usually, but not always. Now, with that process, what happens is the main thing is whether you're having a regular cycle, so whether you're having a regular period. If not, we can give you medications to make that happen. We can also then monitor your cycle. So we'd monitor your cycle throughout the month, usually scan you around day 10 or 11, something like that, depending on your clinic. And what we want to see is the follicle developing. So the follicle would develop, and then what we then do is when we see that you're ovulating, or we give you an injection to make you ovulate, we then put the sperm back a day later, or depending on when your clinic would recommend it being done in your particular situation. So the actual process is relatively straightforward. It's usually 2 or 3 visits. Prior to that, of course, you've got to acquire donor sperm. Now, the way that you do that can either be through our sperm bank, or you can use an external provider if you're wanting to. If you found a particular sperm donor you've seen on a different, Californian website or something, as long as it is a sperm bank that we are happy are completely in line with our regulations. So your clinic will be able to tell you whether the one that you're wanting to use is fine. The main ones are London Sperm Bank, Californian Cryobank, Fairfax now, Deborah, is that
Yeah,
right?
Fairfax, ESB, and I would just
Yeah.
say the only reason we do have what we'd recommend to be partner sperm banks for anyone having treatment with donor sperm isn't because we're trying to, I don't know, be sneaky or do something devious. It's just that there's loads of laws about how much donors can be paid or reimbursed and what screening they have to have. So we work with some banks, and we've gone through their processes and their screening and their payments in really fine detail, so that when we import those amps of donor sperm, we know that they meet our criteria, and we can make sure the HVA are happy with us and that we've ticked all the boxes when it comes to the regulation. So that's why we have partner banks, because we know that they're doing everything properly in terms of reimbursing their donors and screening them.
Yes.
And it depends on wait times as well,
Yeah.
doesn't it? So our wait time has significantly reduced at Care. So you might prefer to use Care's sperm bank. So when you're coming through for treatment, the clinic will be able to give you an accurate estimate, really, of what the wait time is. I think, Chloe, is it about 2 months at the moment?
Yeah, it's quite short.
Yeah.
We've done really.
Yeah. So at the moment there's not too much of a wait. I know that people are being matched within weeks.
Yeah, it's quite a quick process now. So, and obviously it's an advantage of having partnerships with other banks and the information that you get as well. But we will guide you. I think when you are coming for a donation service, we do provide a separate consultation apart from the medical one with the donation team, and they'll talk you through everything, give you access to the bank and all that sort of stuff. So the donation team will really hold your hand, as well as everybody on that process.
And the alternative way really then is IVF, and I'm sure you've probably seen some of the other sessions on IVF, but essentially, in very brief, we give you stimulation injections over about 11 or 12 days, and then we would then do an egg collection procedure, use the donor sperm then to inject it, or inseminate with those eggs. And then we grow those embryos on for 5 days, and we put an embryo back in the person carrying the pregnancy and freeze the spares. The alternative is that we can put it back in the other partner, which is we call shared motherhood, which is quite popular, isn't it, Deborah? Now we do a lot of cycles.
I think it's really lovely, actually.
Yeah,
so the notion is
thing.
2 people. So you've got one person who becomes the birth parent of their child, and the other person who provided the egg to create that child. I think it's really lovely. But if when we do that, it's worth knowing, again, Tom talked earlier a bit about screening when people are preserving their fertility. There's a really strange quirk of the law, and I won't go into it. It's not a law I'm particularly fond of, where if you are sharing motherhood, we have to do some extra infectious screening tests on the person who's providing the eggs. And at Care, I feel quite strongly about this. We try and be as fair as possible to those egg providers and treat them. Tom mentioned earlier, we give lots of information, and we give you the information, and we want you to make an informed choice about what screening you have. But at Care, when you're doing shared motherhood, to try and keep costs to the minimum, we're only required to have the very basic screening that's required by law. There's some extra screening that our professional bodies recommend, and we've got a really comprehensive patient information document that sets out your choices. Anyone who's doing shared motherhood can choose to have all the screening if they want to, but they can also, if they prefer it, just have the minimum that's required by law. So when you come to see us, when you're talking about shared motherhood, we will have some discussions with you about screening tests, and it is pretty complicated, but we have got a really good document. I hope it's a good document that sets out people's choices, and ultimately we leave it to you. The only possible downside, I would say, of having the minimum screening is not all clinics are, if you like, doing this. They don't take the same view, and they insist on people having all of the screening. So if you went off to live in Aberdeen or somewhere very far away from a care clinic and you wanted to transfer your embryos to that clinic, that might be that clinic might say, you've not done all the screening we would normally do. So again, we'll have a discussion with you about the pros and cons of your treatment options. But screening in shared motherhood's a bit complicated, but we can hopefully support you completely in making some informed decisions about what screening you'd want to have.
Yeah. And that's what's really important to us, is that we give you the choice. We let the patients themselves and make their own choices. We can give you all the info, and we make sure it's as accurate as possible. And this is why Debra is so important to Care, on that, to make you understand got your choices and you know what you're doing. We've just had a couple of comments in terms of like prices and donor banks. What I'll do is I'll send you guys that information by DM later on. Or you can get in touch and just send us a message afterwards for any extra info that you want. If anyone wants a clinic brochure for their local clinic or a price list, just comment yes underneath, and I'm able to access the comments thread, and be able to get back to you personally at the event. So it'll be within the next 24 hours you'll get that information. That probably just makes it easier than everyone sort of asking how much and stuff like that, because you'll all get the same. Brilliant. So yeah, is there any other like considerations we might need to make in terms of governance, Debra, with the sperm?
Well, there's issue. Well, I'm not so much about sperm. What I was thinking about was consent.
Yes.
So remember, and this is a bit of the law I'm quite pleased with. The law was changed quite a while ago now to allow a child to have two parents, regardless of the parent's gender.
Yeah.
So the person who gives birth to a child is always a child's legal parent, whether they provided the eggs or not. So the birth parent, if you like. And then that birth parent, if you're having treatment with donor sperm, then the birth parent can choose who their child's second parent is going to be. And as long as that person agrees, you can sign consent forms that allow you both to become the parent of your children. It's only important to sign those consent forms if you're not married or in a civil partnership. If you're married or in a civil partnership, the birth parents, the birth parents' spouse or civil partner will automatically be the child's second parent. If you're not married, you just have to fill in a bunch of consent forms. Again, it sounds complicated. It has been in the past, but we're there for you now. We can give you all the advice you need on how to make sure that you get to be your child's legal parents by signing all the right forms.
We've streamlined it. We know that families are sometimes not the simplest. It's not just a male and a female now. They're from loads of different backgrounds, and we want to support everybody. So that's what our job is to do. We take the complexity out of it. It sounds but it's not. We know what we're doing. We've got it.
Absolutely.
Try not to be daunted or overwhelmed. We'll sort it all out when you come with us, and we'll explain everything. And don't ever feel like if you don't understand something, you can always come back and just double check with us. We never get bored of having to explain it or things like that. Nobody's ever troubled by having to explain it. We want the patients to have a great experience and to grow their family with us and enjoy it more than anything while they're doing it, without all the complexities. So do we want to touch upon a little bit about known donation? Because we do get some patients that come and say, I've got somebody who's willing to donate their gametes to us, whether it's sperm or eggs, to support with their treatment. Does it become a little bit easier if it's someone that they know?
I guess you don't have to. If you like, there's no matching or choice, but the same rules apply. So with any donor, they have to do lots of screening tests, and we make sure it's safe for embryos created with their eggs or sperm to be transferred. There's no risk of infection, for example. We look at donors' health status and things like that. So we are as confident as we can be that it's safe to provide treatment, and there should be. We sort of try and manage the risks of there being an inherited condition, for example, from a donor. So we do have to apply those same rules to a known donor. So it's pretty similar. I think there's quite a lot of tests and screens and questionnaires that a known donor has to fill in. But again, taking your point, Chloe, never be daunted by that. Our teams can guide you through all of the questions that you're going to be asked. So I think it's pretty straightforward if you want to come with a known donor.
Yeah, and I think it's quite beautiful if you know somebody who wants to help the family.
Can I just say there is another type of treatment that we haven't touched on, which is something called co-parenting. So we don't just treat people who are in a couple, if you like, who, so sometimes friends might come and have a child together using their own eggs and sperm, and then they will both be that child's legal parents, but they're not, if you like, living together as a couple. They're going to co-parent that child. So that's another type of treatment where, as you say, families are different, and we want everyone to be able to have the family that they that they want.
And of course, it would be we want children to have two parents where they can, you know, so it's a nice way to, you know, if parents are able to have a great relationship but they're not together, but it means they've got them, and that's amazing.
It's just
but obviously
one of those options.
Again, families are all shapes and sizes. We get solo people coming through, we get couples, we get we've had families where we've had same-sex male couple, and then sister's been surrogate. So there's lots of different ways, all beautiful and all amazing, but we all just want everyone's dreams to come true no matter what way they go. And I think that really is reflected when you come to Care. You just know that everyone's got that same kind-hearted nature. So we've touched upon same-sex females. Shall we move on to same-sex males? Is there anything else that we need to cover, do you think?
No, I don't think so. I think it's very dependent on your individual circumstances, and that's what you'd get from a consultation.
And if there's anything we have missed, guys, please, you can always send us a message, like saying comment below for any of your individual circumstances. But you can, of course, take advantage of the £100 consultation. You know, might as well, and get an expert advice from your clinic as well about your circumstances, as Tom said. So, okay, we will look at a little bit of same-sex males pathways.
So that's obviously usually involving surrogacy, always involving surrogacy. So that process is a little bit more complicated, I think it's pretty fair to say, just because we need to assess not just the intended parents in that situation, but also a potential surrogate. And therefore, the laws around surrogacy are also a little bit more complicated. So we acknowledge that at Care, and therefore we give you a lot more support during your surrogacy treatment than a standard patient would get, for want of a better word. In surrogacy cycles, what happens is we would ask you to register your interest on Care Fertility's website, and then following that, that's picked up by our central surrogacy team, and they would do an initial call with you. And it depends on where you're at with your surrogacy journey. You might have found a surrogate already, or you might just at this stage be wanting to create embryos. So at that point, then you'd get a surrogacy consultation with a nurse, and they'd go through the steps with you and talk you through kind of the legal aspects, parental orders, all of those kind of things get touched on, which often patients have lots of concerns about and questions. So you'd be reassured from that point of view. Once you have found a surrogate, which is typically through charities, you're not legally allowed in the UK to kind of advertise for surrogates or make a kind of a financial profit from a surrogacy agency like you are in the States, for example. We can, however, if you found a surrogate internationally and you wanted to use that surrogate kind of internationally, that's fine. We can support you with that process, and we do have international surrogacy cases at the moment. So as soon as you found a surrogate, we'd ask them to contact us. We're not allowed to contact them, so they would contact us, and then we would basically go through. Well, the nurse initially would go through all of their history and make sure, first of all, that there's nothing, alarming, which would mean that they're not a safe candidate to carry your pregnancy, and also it might be detrimental to them as well. So all of that will get initially checked, and then it gets checked again by a consultant at a consultation with the surrogate. In line with that, we also would have a consultation with you as the intended parents and go through what you're wanting to do. Now, with same-sex and male couples and using surrogates, one part of the process is having to quarantine your sperm, and these are just the regulations that we have to work with, unfortunately. So with that, you would have to do some initial screening again, and then you would then have to repeat that screening in 3 months. and then that sperm can then be used in treatment with a surrogate. So that's part of the process as well. Just to touch on as well, and it's not at all something that you have to do, but you can, and lots of same-sex male couples do choose to do it, you can sperm share as well. And that does actually make your treatment a little bit more cost effective, because it makes it cheaper, and it means that you're also giving something back, which is a nice thing that lots of guys choose to do as part of their treatment. So that's the process, but because there's quite a few parties involved, it can take, it's typically a journey that takes months, and that's why you get lots of extra support. So after your consultation with a doctor, you get a follow-up call with the nurse, and then the nurse will go through what the doctor said. They will coordinate what's happening with the surrogate and whether they're appropriate, whether we need any more investigations for a surrogate. Because typically, I would say what we find as clinicians is that finding a surrogate is challenging in the UK, but typically they're not always the right person to carry your baby. Okay, and that's what we need to make sure of. That's really the process and how we'd support you, and then your doctor would kind of communicate that back with you. So it's a bit of a three-way conversation all of the time.
It's like with any treatment, there's a risk that it doesn't always work out the way we want it to first time, but we'll obviously support you, and that's why we do all this thorough work to make sure that we prevent as much heartache along the journey as possible. Because there's quite stories about couples who've gone through surrogacy and it's not worked a couple of times, and then by the end hopefully they do get that outcome, but we always just want to make sure that your surrogate's prepared, you're prepared as well.
A lot of surrogacy journeys, particularly for same-sex males, are not complicated journeys because, in general, there's not a fertility problem. You're coming to us because you want a family, not because you're struggling to get pregnant, like a lot of patients that come to see us. So in general, it does go well, but of course, it's just having that awareness in the back of your mind that the journey can be a little bit fragmented.
Yeah. Just like you said, you might want somebody to be your surrogate, but we've got to make sure that they can carry your pregnancy as well. So that's just probably the biggest risk. But we'll always support with that. And then there's the two types of surrogacy as well. There's straight and I've forgotten the name.
Straight and gestational surrogacy.
Yeah. I mean, it's very so straight surrogacy is when the surrogate is using her own eggs as part of the treatment, which is really rare these days for us to do. We do it occasionally, but it's not a common method of using a surrogate, I have to be honest. So yeah, again, that's something that we would discuss with you. The surrogate, in all situations, depending on the type, has to have counselling. If they've got the partner has to be involved in that counselling. And then again, the surrogacy team would support them with the legal aspects that are required from their side, and all of the consents, just to make sure that the intended parents eventually become the legal parents. The law in the UK is a little bit dated, unfortunately. It is going through a reform process at the moment, which hopefully should make it a lot more straightforward for our patients and clients. But we're still not there yet with it, so we have to work with what we've got. I don't know whether, Deborah, you wanted to touch on anything from the law side.
I think you've got it covered, if I'm honest. I think the law is a bit complicated at the moment, and I know Care's worked with the Law Society to sort of comment on where there are barriers for our patients. I think the key bit is that we want to work with you to make sure that at the end, if you're the intended parents, you can become your child's legal parents. And so there's some sort of hoops that you have to jump through to prove that you can get a parental order at the end of the journey, because that's when you become the legal parents of your child. So we'll try and guide you through that, but it is a bit complicated, and you have to meet certain requirements of the law. But one interesting thing that was published though this week is that we're aware that there are some changes to help patients who might be HIV positive. So up to now, it's really hard. We have to screen the person providing sperm for a surrogacy, and eggs. Obviously, we screened them, and if they were HIV positive, technically, well, we couldn't create embryos that then will be transferred to a surrogate, which was a barrier for a lot of people. But we know that the regulator is working to try and rectify that situation. I don't think it's happened yet, but at least it was in the press this week that that's on people's agenda. So this is where someone might, HIV treatments have really come a long way.
Yeah.
And people might have antibodies in their blood, but that doesn't mean they pose a risk of infection. So we can do tests to actually make sure that there's no what we call viral load. They haven't got any viruses in their blood. And I know that's a change that's coming. So hopefully that's a positive thing for the future for anyone who's HIV positive.
Yeah, for sure.
There are things that you can do, sorry to interrupt, Chloe, in terms of making yourself more attractive to a surrogate as well, and that's what the doctor will in terms of coming and being your surrogate, because it is hard sometimes to find a surrogate. So one way in particular is that if you've got genetically tested embryos, so euploid embryos, so sometimes we will recommend that as part of your surrogacy process. You don't have to do it, but like I said, it does make you, as intended parents, for want of a better word, more attractive, because it means that the pregnancy rates per embryo transfer are much higher than if they were untested, which is important when you're I guess burdened by the cost of surrogacy, because you're covering the cost of the treatment and the expenses of the surrogate, particularly if it's international. They can stack up quite quickly. So if you've got a genetically tested embryo, then per treatment your chances are much higher. So that's something we would talk to you about.
Yeah, for sure. Brilliant. I've just had a question in while we're just on this pathway. Just wanting a little bit more detail about sperm sharing and how it sort of reduced the costs. But Tom did refer to it briefly as like sort of giving back. So a lot of patients they're going to have help. They want to give something back and allow other people to have their family as well. So if we could just touch upon that briefly, and then we'll put, I think we'll almost be done if we've got any extra questions, but I think that might be everything that we need to cover.
Yeah. So that would be just something that you'd have to mention to the surrogacy team, and they'd have to give you, because it depends on what treatment exactly you're having and how that would affect the cost. But yeah, they would be able to guide you really on that. But as part of the process, the only thing to mention, I suppose, with sperm sharing is that, yeah, a lot of guys do it. It is a great thing to do, but just bear in mind that it does typically make the process a little bit longer, because we have to get so many donations in before you then start your own treatment. Okay, so we typically, I think it's about 10 visits, something like that from memory. So doing all of that over a series of weeks can just make it a little bit longer. But yeah, the donation team are very good, so they will guide you through that process and what it looks like. And then as part of the process, because you're a donor, we would then essentially cover a lot of the costs as part of your screening and all of those kind of things, because whilst it's part of your treatment, we require them as well in order to use your sperm for other patients.
Yeah, so it's a really, really good thing to do, actually, and it's a lot of benefits to it. No, that's really, really helpful. Hopefully that has answered your question, but again, if you do want more detail about anything that we've covered, just let me know. We've had sort of one final comment, and then we'll kind of potentially wrap it up. We'll see if we want to mention anything else. Just had a question saying, how long is it sort of between maybe first inquiry or consultation to starting IUI? I guess this can vary between clinics, but what do you typically kind of see, Tom?
It does vary between clinics. Typically, it's not very long. Again, it depends on your sperm and whether you've got your donor sperm. So that's probably the limiting factor. If you've got your sperm already, or you've got it ready in an external bank and it just needs shipping to us, I think the donation team like a little bit of time in order to make sure everything is ready in terms of your consent and everything. But yeah, typically, particularly for sperm donation, it doesn't take very long.
Well, so yeah, And what we do as well is once you've had your consultation, we'll know whether you are going to be on, is it sort of like a little bit of medication for your IUI cycle or not. That can sometimes affect it because we'll need to draw up your protocol, order your meds and stuff like that as well. So you do get more of an estimate when you do actually book your consultation. We can tell you, we've kind of got like live updates about everything that's going on. We can speak to you about what your wishes are, whether you want to use the care bank, whether you want to go with one of our partners. You know, because at different stages, people sometimes come and they know everything.
Yeah.
It feels you don't need to explain a lot to them, and then some people do need a lot of guidance, which we're more than obviously happy to do. So yeah, it just depends on where you're at and things like that. So,
And I would speak to your local care clinic about the packages that are available for IUI in particular. So not all of them have them available at the moment, but for example, Manchester, there's a 3-cycle package, which makes it more cost effective as well.
Yeah, so that's really good. So yeah, just speak to our new patient inquiry team. They are available from 8 o'clock in the morning, or you can always send us messages. You know, just to get that advice, because we know that people are at different points. Some people are ready to book and are ready to go. Some people are doing research for the future. So this is why we've done these Fertility Awareness Week events, to cover all bases. Hopefully get your questions answered. Is there anything else you think we need to touch upon? I know we've done single people pathways and transitioning. We've done same-sex male and female couples. We've touched on a little bit of surrogacy. We are touching more upon egg donation on Thursday. That's my next event. But is there anything else we might need to just take into consideration in terms of a governance point of view or medical? But if not, we can wrap that up, I think.
I just noticed there was a question about age. So in reciprocal IVF, the law says that the egg provider should be 35 or under, but again, this is about the informed choice. That's because as we get older, eggs age, and there could be a higher risk of miscarriage, for example, or abnormalities. But we don't impose that bit of the law when it comes to shared motherhood, but we have to give you information about the risks of using eggs from a person who's aged over 35.
Yeah.
And I think, Tom, clinically there comes the point where actually your chances of success would be diminished if the egg provider was aged maybe over about 40. Tom, would that be right?
Yeah, I mean, as you said, from 35 onwards up until 43 really is the main decline in egg quality. So even someone young that's less than 35, half of the embryos that they create from treatment will be genetically abnormal.
Yeah.
Whereas 42, for example, that's going up to 80-90%. So we would counsel you about that in terms of known donation and that kind of thing in particular.
Yeah. Well, then that leads us nicely on to, I think, wrapping everything up, but then I can talk to you about our next events coming up this week. So tomorrow, Amy's going to be covering IVF advancements and how they help. So we've just touched upon genetically abnormal embryos, but we have got advancements at Care that we can look at, which help you with that. And one of the biggest changes is that PGTA testing has now been changed by the HFEA to have a green lighting for all patients using it, that it reduces the chance of miscarriage. Amy will talk to you a little bit more in detail about that and what that means and everything like that. And then Debra can also answer any questions you have upon HFEA ratings. If you just get in touch, we're always happy to let you know. Because they have changed it quite significantly now. It's not just a straight traffic light system where it's green, yellow and red. Now there is little things and more considerations taken into account for different treatments. So Amy will touch upon tech tomorrow, and then there'll be a little bit more on donation on Thursday with myself and Julie from Manchester. We will talk to you about like egg health donation, how we screen them, when patients might consider using donor eggs as well, and what that looks like. And then on Friday we've got Professor Charles Kingsland closing out the week with a little bit more info on IVF and fertility treatment. So just a little bit more touching upon what we did last night, but just to give you a chance to ask any more questions on that and different treatment pathways if you have them. But I think that's been 45 minutes actually, which has not been too bad. We did say half an hour, but if anyone needs absolutely anything, please comment yes underneath if you want a brochure and price lists from your local clinic, and I'll get in touch with you personally And then don't forget that £100 consult offer as well. Take advantage of it. It's available until the 30th of November, everybody. But I hope you enjoyed it. And thanks, Tom and Deborah. You've been amazing.
Yeah.
Thank you, Chloe.
Have a
Good
great
luck, everyone.
later.
Cheers.
Bye.
Bye. Bye-bye.